Getting a serious diagnosis can feel like, well, just a whirlwind of tests, appointments, and a lot of confusing terms. So today, we're going to try to demystify that whole process. In this explainer, we're going to follow one patient's actual medical journey, step by step, using their real documents to decode the path to a diagnosis of chronic lymphocytic leukemia, or CLL.
All right, so here's the game plan. We're going to start with the very first symptom, then move through the blood work and the imaging that helped build the case. Then we'll pinpoint that exact moment of diagnosis, and finally get into how doctors figure out a prognosis and what the next steps look like. Think of it like we're piecing together a medical puzzle, one test at a time.
Every diagnostic journey has to start somewhere, right? And a lot of the time, it begins with something that seems pretty small, a physical sign that just tells you something isn't quite right. And here it is. This is the very first clue. This report, from way back on November 11th, 2020, it documents the patient's first complaint, swellings in the groin. And that simple observation, that's what kicked off this entire investigation. So from there, doctors did what's called a fine needle aspiration. They take a tiny sample from one of those enlarged lymph nodes, and the initial impression, it pointed towards a non-Hodgkin lymphoma. Now, keep in mind, this wasn't the final answer, not by a long shot, but it was a critical signpost telling the medical team, hey, you're on the right track and you need to dig deeper. The next major piece of the puzzle came from the blood work. A simple blood test can tell you a huge amount about what's going on inside your body. And in this case, the results were a massive red flag. Okay, just look at this number. The patient's total white blood cell count was 24,500. A normal range usually tops out around 10,000. So this is more than double the high end. It's a crystal clear signal that the body was just overproducing these cells like crazy. And here's where it gets even more specific. Of all those white blood cells, a whopping 73% were lymphocytes. Normally, that number should be between 20 and 40%. This kind of massive imbalance strongly suggested something called a lymphoproliferative disorder, which is really just a technical way of saying the body is making way too many of these specific white blood cells. So the blood tests are basically screaming that there's a problem. The next logical question is, where is this problem and how widespread is it? And for that, you've got to look inside. That's where advanced imaging comes into play. This is just a fantastic illustration of how this technology works. On the left, you see the actual PET-CT scan with all these dark hotspots. Those show areas where cells are super active. And on the right, that's the radiologist report describing those exact same spots as enlarged lymph nodes. You can literally see how the picture and the words are telling the exact same story. It's a perfect match. And the crucial point here is that this wasn't just a localized issue in the groin where it started. The scan and these reports confirmed the disease was systemic. We're talking enlarged lymph nodes all over the body, in the neck, the armpits, down through the chest, the abdomen, and the pelvis. All right, so the pieces are really starting to come together. The blood work pointed to a problem, and the imaging showed that it was all over the body. The next step was to get a definitive cellular diagnosis, to really pinpoint the exact nature of this disease. And to do that, doctors went straight to the source, the bone marrow. That's the factory where all our blood cells get made. The report from this bone marrow aspiration gave another really strong clue, with the impression being suggestive of chronic lymphocytic leukemia. And then we get this. This is it. This is the aha moment. While all the other tests were suggestive, this peripheral blood smear report from November 28th puts it right there in the impression section. Chronic lymphocytic leukemia. This is now the working diagnosis. Okay, so the name is on the paper, chronic lymphocytic leukemia. But what does that actually mean? And how do doctors go from having a really strong suspicion to being absolutely 100% certain? Well, in simple terms, CLL is a cancer where the bone marrow just goes haywire and produces way too many abnormal lymphocytes. These abnormal cells aren't very good at their jobs, and they start to build up in the blood, in the lymph nodes, basically crowding out all the healthy cells that are trying to do their work. To be 100% sure, doctors use a really cool high-tech test called flow cytometry. The best way to think about it is like this. Every cell in your body has these unique little protein markers on its surface, kind of like a barcode. This machine is smart enough to read those markers, creating a specific fingerprint that can definitively tell you exactly what kind of cell you're looking at, including cancerous ones.
And there you have it, the final word. After analyzing that cellular fingerprint, the flow cytometry report came back with its conclusion, consistent with chronic lymphocytic leukemia. This is the gold standard confirmation. Case closed. The diagnosis is now certain.
But getting the diagnosis isn't the end of the story. Because here's the thing you have to understand. A CLL diagnosis is not one size fits all. Not all CLL is the same. Understanding the specific genetic makeup of the cancer is absolutely crucial for predicting how it's going to behave. This is done with a test called FISH. It's basically a genetic deep dive into the cancer cells themselves to look for specific changes or mutations in their DNA. And these little genetic quirks can tell doctors a ton about a patient's prognosis and really help guide what treatments to use down the line. So for our patient, the results of the FISH test were really significant. It found something called a deletion 13q, and this specific genetic change is actually good news. It's associated with a more favorable prognosis, which usually means a slower progressing, less aggressive form of the disease. For many patients who get this result, it can mean a long period of just watch and wait before any treatment is even needed. This is a perfect example of why these deep dive genetic tests are so incredibly important. So just step back for a second and think about this journey. We started with a simple physical symptom, a swelling, and now we have a highly specific genetic profile of the cancer. It's this incredibly detailed picture that makes a truly effective action plan possible. Because a complete diagnosis is so much more than just a label for the disease. It's a detailed roadmap. Knowing the exact type of CLL and its unique genetic markers allows doctors and patients to have a really informed conversation about the future. For some, like this patient with a favorable prognosis, it might mean years of just watch and wait with regular checkups. For others, with different genetic markers, it could mean starting targeted therapies much sooner. And of course, the disease can change over time, which is why that ongoing monitoring is so key. But this initial super detailed diagnosis, that's the foundation for every decision that comes next. And that really is what this all comes down to. Following this patient's path shows us how each test builds a clearer and clearer picture. It hopefully empowers you to understand the process and maybe more importantly, to ask the right questions. Because probably the most powerful question any patient can ask their doctor is this one: what does my specific diagnosis mean for my journey?